For months now, Oregon lawmakers from both parties have worked on ways to tackle the drug problems in our state. They rolled out the results of their efforts last night in Salem during the first day of the 35-day session that's now underway. At the center of the target for change, Measure 110, which decriminalized drugs. Now, I want to warn you, there are a ton of changes and ideas in this bill that they're working on. But I know that you care deeply about this stuff, and we do too, so we're going to get into what we think are some of the key details of the proposal tonight, and then we'll dive into other elements of the bill on other nights as the session goes along. Ready? Good. Here we go. The Joint Committee on Addiction and Community Safety Response, I know, quite a name, met at 5 o'clock yesterday. It's here that they rolled out the details of House Bill 4002, which will end Measures 110's decriminalization of drugs if it gets all the way through the session, which does seem likely. The co-chairs are both Democrats and both former prosecutors. Jason Kropp is from Bend. His career includes working as a public defender in Portland and later as a deputy district attorney in Deschutes County. Kate Lieber here is from the Beaverton area and worked as a prosecutor in Multnomah County. So these folks do know something about law and order and about how the criminal justice system works from the inside. And they also believe that decriminalizing drugs did not work the way it was intended, so they're going to change that. Here's one of the charts used to explain the difference. Right now, under Measure 110, it's a Class E violation to possess less than 40 pills of hydrocodone, methadone, or oxycodone, less than 1 gram of heroin, less than 1 gram or 5 user units of fentanyl, less than 1 gram or less than 5 pills of MDMA, less than 2 grams of cocaine or methamphetamine, or any other amount of any other controlled substance. Under the Joint Committee's new law, all of that would change now to a Class C misdemeanor, which is the lowest misdemeanor. But it's more serious than that Class E violation, which only brought a ticket. Okay, so you follow that? Basically, what they're saying is everything right now that is not criminalized under Measure 110 will be criminalized. Now, there's some argument over whether the new penalty would be a Class C, or if that's not serious enough, not a big enough stick to compel change, maybe should be a Class A misdemeanor, but we're not going to get into that debate tonight. We'll save that for another day. We've also heard a lot of talk from both Democrats and Republicans that this is not a return to the war on drugs, that there will be a serious emphasis on drug treatment to help people. To that end, the bill would create what's being called a deflection program. It would be coordinated by a local mental health authority, would be free to the person using it, and would be available within 30 days of the person being referred by police. Okay, so drugs would be recriminalized, but people caught with the drugs by police would get referred by police to a free treatment program. And if they go through that treatment program, actually if they do an assessment and just one follow-up, the entire Class C misdemeanor disappears, gone, wiped from existence. Jessica Menifee with the Office of Legislative Counsel, which helped write the actual law and then explain it back to the lawmakers, described how the misdemeanor would go away through something called an affirmative defense.
For those new Class C misdemeanor offenses, there is a new defense. In my previous presentation, it was a regular defense. It has now become an affirmative defense, and I'll talk about what that means in the next slide. Basically, there is an affirmative defense for this new Class C misdemeanor if the person completed a qualified diversion or deflection program that they were referred to when they were contacted by the police officer concerning the conduct constituting possession, or if they were never referred to a qualified deflection program when they had that contact with the police officer. That second defense can only be asserted by the defendant if the police officer had probable cause for no other charges at the time. There is a notice requirement for the defense, so the defendant would need to provide notice to the state of the intent to assert the defense at least 21 days before the first trial setting. And the notice needs to be accompanied by any document that the defendant intends to rely on in proving the defense. And the terms completion and qualified deflection program are defined terms in the bill. I don't have the page number off the top of my head, but completion basically means that you conducted a screening and one additional contact with the deflection program. And the qualified deflection program I'll just talk about in the next slide.
So there you have it. Right now, under Measure 110, people using drugs can be given a ticket and a phone number to call to talk about their struggles. If they call that number, they can get the ticket erased. But the problem is almost nobody does that. So now lawmakers are hoping that with a more serious charge, this Class C misdemeanor, people with drugs will be motivated to at least meet twice with this deflection program. If they ignore that, the punishment for a Class C is up to 30 days in jail or a $1,250 fine or both. Now, as part of the broader discussion of drugs and mental health, but still under this bill, House Bill 4002, there would also be a task force set up to study Oregon's mental health system to try to find ways to make it more accountable. Well, that brought a question last night from Republican Fred Girod from the Staten area.
What I would like to see in that bill is something that to the effect of the dollar amount that we're spending on something versus the efficacy. And that would give you the dollars per success. Because we can throw a lot of money at the wall, and if we're not getting any successes out of it, it's really money not well spent. And I'm a big opportunity cost sort of person, and we got a Oregon Opportunity Grant we're not funding, and so I want to make sure that if we're going to spend all this money, that we are actually going to get some success out of that.
Now, I picked that comment because it's something that we hear a lot from you. Where are the numbers? What was the goal for whatever program? And did they hit it or did they miss that number, and why? Are we getting our value for our tax dollars? Well, Senator Elizabeth Steiner said she had asked that very question earlier in the day.
They brought up the very interesting point that it's hard to define success in substance use disorder treatment, in part for example, if you have somebody who was using opioids and is now only using cannabis, is that a success or a failure? Well, we don't really know. And there's not clear standards in literature. Forgive me if I'm misquoting you guys, but I think I got it right. And how we collect data on some of these things, for example, community outreach programs where people go out and try to build trust with people living on the street so that they can eventually get them into treatment. How do we measure that when people aren't going to ask for their things? You know that I am a staunch supporter of evidence-based policy, Senator Girod, and that's why I was struggling to ask these questions.
All right, there was a lot more in that hearing last night, but there will also be many more hearings, so we'll dip in from time to time and look at different pieces of it. In the meantime, what do you think about these proposed changes? Send us an email, will you? We know you have a lot to say, and we do love to hear from you. The address here is thestory@kgw.com, or you can call and leave a voicemail, 503-226-5090.